How do I complete my profile? Your profile includes your diagnosis, demographics, and treatment information. When you're registered and logged in, click the My Profile link. If you start your session as a guest, the information you enter in the short series of questions will automatically be added to your profile. You can add or update your profile details by hovering and clicking the pencil icon. Your treatment history information plays an important role in determining whether you are eligible for a trial. For example, some trials require that you have received a certain number or type of prior treatments, while other trials are for people who have not yet received any treatment for metastatic breast cancer. Let's walk through the process of adding your prior medications for metastatic breast cancer to your MTS profile. Don't worry about entering your medications in chronological order. MTS will arrange them for you. For example, let's say you have hormone receptor positive, HER2 negative metastatic breast cancer, and your first treatment included hormone therapy and a CDK inhibitor taken together. On your MTS profile, you can enter this information by clicking Add a line of therapy. A line of therapy refers to all medications taken at the same time. You can click Add or Edit Medication to add the two drugs you took together for this line of therapy. If the treatment you received was a combination drug or a regimen, which is more than one drug received at the same time, be sure to input each individual drug into this line of therapy. You can always consult your doctor for more information about the drugs you've received. For this example, let's add Femara, a hormone therapy, and Ibrance, a CDK inhibitor. Or you could search by their generic names, letrozole and palbociclib. You can also sort by brand names and generic names to see the drugs in alphabetical order. Or you can sort by category if you can't remember the name of the drugs. If you have any questions about the drugs you've taken, be sure to check your medical records or ask your doctor. Click Add for each drug to include them in this line of therapy. Click Apply to confirm the medications in this line of therapy. Next, you will enter whether you are currently on this treatment. Input the start date for the medication, and if you're no longer on the treatment, include the end date. These dates can be estimated. They do not have to be exact. You will also be asked if your cancer progressed while on these drugs. Now, click Apply again to complete this line of therapy. Once you have finished adding all prior lines of therapy, you can add the treatment that you're currently taking. This is a new line of therapy, so click Add Line of Therapy again. For this example, let's say you're currently receiving Abraxane chemotherapy. Once you click Apply, simply click the button that says you're currently on this therapy and enter the start date. What if you participated in a clinical trial as a line of therapy? When choosing the medication, select Experimental as a drug option. If you also received any standard of care drugs in the clinical trial, be sure to add them to the line of therapy as well. If you don't see the name of the drug you received, you can select Other. In this example, you have now completed your drug treatment history. Finish your health profile by entering any radiation or surgery you've received for metastatic breast cancer. You can also enter any medications you received for your initial breast cancer diagnosis. To make things easier, the system does not require you to input dates for your earlier treatments, since only the types of drugs you've received affect your current trial eligibility. With your health profile completed, you are now ready to save and view trials that match your diagnosis. If your treatment ever changes, update your profile to ensure the most accurate trial matches. Do you need more help? You can always call or email us if you need help filling out your profile or understanding how to find trials using MTS.